Hello everyone. Today I'm Harshvardhan Singh Kushwa, a student of class 10th A. I'll make you all aware about a lung disease which is asthma. So let's get started. Now, the question will come in the minds of everyone that what is asthma? Asthma is nothing but a chronic lung disease which a person's airways become inflamed, narrow, and swell and produce extra mucus which makes it difficult to breathe. As you can see in this image, there are two types of airways in which one is normal airway which have sufficient space for air to flow and another one is inflamed airway with the presence of mucus. The asthma is the most common chronic disease among children. So children need special protection. The next thing is how it's look from inside. As we can look in these two images that the first is normal and the second is during the asthma symptoms. In normal image we can see that they are thin muscles and airway walls which have sufficient space for air to flow, while at the time of asthma symptoms the muscles become inflamed, tightened, and the and there's also the production of mucus which further constrict the airways. As you can see in this image, the muscles are inflamed and the mucus is also present on the airways which further restrict the flow of air. So now let's have a look at some symptoms. The common symptoms of asthma includes coughing, wheezing, tightness in chest, shortness of breath. Now we'll look toward the causes. While the exact cause of asthma is not yet known, it is thought that a variety of factors interacting with one another early in life resulting in the development of asthma. As you can look in this image, there are various asthma causes mentioned. The first one is pet danger, stress, certain medications, dust, chemical and perfumes, air pollutants, smoking, genetic, respiratory infection, some foods and beverages. Now let's move to some further causes. It can also be transferred from a parent suffering from asthma to their offsprings. It is a genetical tendency to develop allergic disease like asthma. Childhood respiratory infection can also lead to this deadly disease. Exposure to allergens or infections while the immune system is in developing stage can also cause asthma. Now we'll look at some asthma triggers. A variety of things can cause asthma. Some symptoms to appear: allergens, irritants, food and drinks, medications, physical activities, upper respiratory infection such as viral can also cause asthma. Increasing rates. It is estimated that the number of people with asthma worldwide will increase by 25% in next 15 years. The prevalence rate varied from 54.9 per thousand population for reported cases and 9.1 for diagnosed cases in India. You can also have a look toward this statistical data which shows the number of patients of different age groups. Now, the worldwide burden of asthma. 339 million people suffer from asthma worldwide every year, and 418 million asthma deaths were recorded in 2016. Over 80% of asthma deaths occur in low and lower middle income countries, which makes their situation worse. Now, we'll look at some possible treatments. While asthma cannot be cured, but it can be controlled. Learning to recognize one's own triggers and taking steps to avoid them. The second one is bronchial thermoplasty. It is a treatment for severe asthma based on local airways, delivery of radio frequency at 65 degrees Celsius, thus heating the tissue and reducing the amount of smooth muscles present in airway walls and cause the sufficient amount of space for air to pass through it. The next treatment is oxygen therapy. It is used for acute asthma and aims to achieve oxygen saturation of at least 92%. However, the emergency oxygen guidance suggests a range of 94 to 98%. The bronchodilators or rescue inhalers. These are the types of medication that makes breathing easier by relaxing the muscles in the lungs and widen the airways, which are bronchi. They are often used to treat long term conditions where the airways may become narrow and inflamed, such as asthma, a common lung condition caused by inflammation of airways. So, that's it for this topic. Thank you very much. I hope you like it.